Hi, I'm Trisha Aquino, Puma-podcast, and you're listening to Teka Teka News, balitang thinking, hindi breaking. In this episode,
Minsan advanced stage na, malabo na yung mata or hindi na sila nakita, that's the only time they go to the doctor, no? Kasi iniisip nila mahal, hindi nila kaya bayaran ang consultation.
we talk about taking care of our eyes and how the government and the private sector come together for the vision health of every Filipino. It's Diabetic Eye Disease Awareness Month, and doctors recommend that people who've had diabetes mellitus for some time now get vision screening. That's because they're at risk for diabetic retinopathy, which is what happens when the retina's blood vessels are damaged. Catching this early can help prevent blindness and lower health costs too. Vision screening is something that can be done at the primary healthcare level. Ibig sabihin, pupunta ka lang sa barangay health station nyo at may personnel ng capable na tulungan ka. Here's Dr. Alan Esino of the Department of Health. He's in charge of the government's Prevention of Blindness program. At bahagi nitong programang to ang pagtatag ng Community Eye Health Programs o CEHPs.
So, ang ating community eye health, from the word itself, community, this is community-based. So, talagang entry point natin dito is the primary care facilities natin. So, dito, nag-conduct tayo ng ating mga visual screening. So, dito nagkakaroon ng mga early diagnosis and treatment, no, which is part ng training na binibigay natin sa kanila. So, meron tayong na-establish na referral system wherein, depende sa case nila, they will be referred to the specialty hospitals or yung ating mga next level of care, no. Once na yung isang pasyente, halimbawa, nagkaroon ng problema or concern sa mata, so they will be assisted sa ating primary care facilities. Then, depende sa case nila, yung iba pwedeng ma-manage na actually at that level, no? Yung iba, they can be referred to a higher facility na, no? If the patient requires, no, a specialized care na. So, kumbaga nilalapit natin yung programa more on sa primary level para mas marami tayong maabot. So, LGU-based, we partner with the rural health units, no? So, ating rural health units, sila yung nagmo-mobilize ng ating mga barangay health stations.
Community eye health teams are organized per area, and they receive workshops on primary eye care training. They're also given materials used for vision screening. Despite the free services Filipinos can take advantage of right in their barangays, there are still hurdles to overcome. Here's Dr. Jubaida Aquino. She's an ophthalmologist who specializes in the retina.
Pero ang problem ngayon doon would be yung financial capability of the patient. So kung i-refer siya outside of their town, paano yung pamasahe, paano yung sino yung kasama niya na magpa-check up, mag-absent yon sa work, wala silang kikitain for that day. Meron silang mga financial needs, no? Kapag nag-travel pa sila, yung transportation, pamasahe.
Dr. Jubaida recalls seeing poverty-stricken patients who go to the DOHI Center in East Avenue Medical Center.
Minsan, makikita mo yung patients, meron silang baon na nilagang itlog. Yun lang yung lunch nila for that day. So, sa mga government hospitals, mahaba ang pila. And yet, since kasi financially challenged sila, nagtitipid sila sa pamasahe, titipid sila sa pagkain nila habang naghihintay para ma-check up doon sa doctor. Marami tayong magagandang government eye centers dito sa city natin, sa Metro Manila, and nakakapagpa-check up yung mga kababayan natin doon sa eye centers na yon na walang kailangang bayaran. Okay. Pero ang naririnig ko sa mga patients, kahit libre yung, let's say, pa-opera or libre yung gamot, yung injection sa mata, kailangan pa rin nila ng panggastos eh. Kasi kung ooperahan sila, kailangan ng clearance. Yung clearance, kailangan yun ng mga laboratory workup, kailangan yun bumalik sila para ma-check up sila ng internal medicine. So, kailangan nila ng pera while doing that. Mga ibang patients, pumupunta sila sa DSWD na nagpo-provide naman ng assistance para magastos nila yung financial aid na yon prior to doing the procedure. And then yung mga eye drops kasi after sila maoperahan, kailangan ng maintenance medications, 'di ba? Kailangan ng antibiotics, kailangan ng steroid eye drops. And so, yun mahal din.
With all the government agencies that Filipinos need to turn to for help, Doc Jubaida sees the need to create a one-stop shop. Yung isang puntahan na lang, makukuha na nila ang lahat ng kailangan nila. Hindi na rin nila kailangan ng pamasahe para pumunta sa iba't ibang opisina. Another important component in vision health for every Filipino is PhilHealth. Para kay Doc Jubaida, kailangan ng expanded coverage.
Yung PhilHealth natin, no, yung coverage niya focuses more on treatment rather than prevention of disease. So ang nangyayari, kung walang nararamdaman ang pasyente, hindi siya magpupunta sa hospital kasi yung wellness, 'di ba, may tinatawag na executive check-up or wellness check-up for patients. So hindi kino-cover 'yun ng PhilHealth.
Kaya rin yung ibang mga pasyenteng may diabetes, minsan huli na at affected na ang kanilang paningin bago sila pumunta sa doktor.
So with regards to PhilHealth, what's important is that we have yung existing packages. Let's say when you have retinal diseases, cataract surgery, or maculopathy. So lahat yan, there are existing amounts.
That's Dr. Diana Edralin. She's the president of the Pharmaceutical and Healthcare Association of the Philippines and the general manager of Roche Philippines. Roche is one of the world's largest biotech companies.
But as you know, inflation comes in every year. So paano nag-a-update yung budget na yon every year so that it actually adjusts for the inflation?
So the private sector also has a role to play.
We have these healthcare management organizations or HMOs or health cards or basically private insurance. I think there is also an opportunity to further expand coverage in terms of supporting vision health or eye health. Because right now, if you will observe, as you grow older, unfortunately, the coverage of the private insurances also gets reduced or you don't have the opportunity to expand it.
We already know this. Malaki ang sarili nating gastos tuwing nagpapagamot tayo. According to the Philippine Institute for Development Studies, around 40% ang out-of-pocket expenditure natin pag may medical bills. But there are some ways around this.
I'll take Thailand, for example. Thailand in Asia Pacific and United Kingdom, let's say in Europe. Medicines are cheaper because there is a significant proportion of the cost of those medicines that are actually being paid for by the government because the government it's like economics, law of supply and demand. When you actually are ordering in bulk, remember it also becomes efficient when it comes to production, shipping, distribution, and they can actually negotiate for that. So there are even models, pricing models for these specific countries wherein it's paid for outcomes. Ibig sabihin, if you're saying that this new treatment will cure visual impairment within, let's say, a year, kunyari lang yon, and if you don't achieve that, the government doesn't even pay for it, right?
Mind-blowing.
And currently, the universal healthcare law has that provision. We call it pooled procurement, centralized procurement. So there are provisions to actually take down the prices at a level that is comparable.
But for Dr. Mavi Rondaris, it's not just cost that prevents us from taking care of our eyes. Doc Mavi is the country manager of the Fred Hollows Foundation in the Philippines. Its mission is to prevent blindness worldwide, especially among women, children, persons with disabilities, and indigenous people.
I think ang pinaka-gap talaga is yung education. Kapag na-empower natin ang ating komunidad na ito ang kahalagahan ng ating mata and vision, gumaganda ang pananaw nila na alam nila ngayon na kung kailan sila pupunta sa doktor at kung kailan sila magpapa-check up. Marami pa rin tayong mga myth and misconceptions yun, yung lalo na sa mga bata na sinasabi natin, wag mo munang dalhin yan sa doktor, bata pa siya. Hayaan mo na, baka mawala yung labo ng paningin na yan, baka mawala pag tumanda siya ng konti.
And that was today's episode of Teka News. For the full version of the story, go to A Better Normal on your favorite podcast app. Look for the episode Seeing from All Angles, How Teamwork Can Make Vision Health Happen for Every Filipino. Again, I'm Trisha Aquino, Puma Podcast. This episode was produced by myself and edited by Mark Casilian. Follow Teka News and A Better Normal wherever you listen to podcasts. At kung mahilig kang manood sa YouTube, pumapodcast na rin po kami doon. Thanks for listening.